morning and warm welcome to everyone joining our platform today. It is my immense privilege to introduce Dr. Bharti here as our esteemed speaker. Ma'am is serving as an associate professor in the Department of Pharmacology at DJ Medical College, Ahmedabad. Ma'am has over 28 publications in both national and international journals, and uh, those have received immense applause from all national and international conferences as well. Going beyond the scope of pharmacology, ma'am has also set up a foothold in the field of advanced statistics, and so is ma'am here to share her knowledge with us on the topic of multivariate analysis. So over to you, ma'am. I hope this topic provides an insight to all of us.
Yeah. Okay. Thank you. Thank you, dear. Uh, First of all, good morning to all and welcome to this multivariate analysis. Uh, just I first highlight what are the objectives. So today's at the end of the session, all the participants should be able to know about multivariate analysis. What is it and what are the different types? Then what are the different methods are under the umbrella of multivariate analysis? And we just discuss only 2 to 3 methods because it is a very vast subject, multivariate analysis. So I will explain 3 methods with example and what is the interpretation if you want to apply this method. Okay. So this is the learning objective. This is the today's overview of the lectures. First, we start with some introduction, then brief about what are the difference between variables and data, what are the univariate and bivariate descriptive and inferior statistic, because this is the basic foundation, because we all are deal with this common univariate and bivariate descriptive statistic. But now, and what is the difference between population and sample? And now the today's era where the majority, if you see that all of you in social media or in website, you have heard about this different terminology like machines learning, NLP, artificial intelligence. So these are all the softwares or algorithm, which is the main foundation of this all this machine learning or artificial intelligence and software. It is mainly the multivariate principle. How you multivariate analysis was done. So we just again in this multivariate analysis, there may be 2 types, descriptive statistic and inferential. Then we go into what is the difference between ANOVA and MANOVA. And lastly, we discuss with the different techniques with the example. So all statistical techniques that we usually use, that what do you mean by multivariate analysis? Now, by the name, you can say that univariate means this is the one variable. There is only one variable you analyze. This is univariate. When you consider 2 variables, this is a bivariate. And when there is a more than 2, it may be a 1,000, 100, 10,000, whatever the variable you include. So more than 2, it is considered as a multivariate analysis. So what in this technique you do that you simultaneously evaluate all variable at the same period of a time by different techniques or methods, which you under the your whatever the your project or research or what are the objectives. Now, why we need multivariate analysis? Now, most of the participants, I agree with me that suppose I am sharing my experience that when I have done the MD or research, then what we do, we commonly, we find out the mean, standard deviation, then we forward some variance, confidence interval, then we apply statistical t-test, chi-square test, majority, maybe some go further ANOVA, but then we stop. But now today's era where there is artificial intelligence and where different statistical software are available, now today's era is all the basis on multivariate analysis. So that is why it is needed to learn and to apply this method in our research. So I'm quoting this famous Tom Perry said in his book, Thriving on Chaos, that we are drowning in information and starve for knowledge. So there are lot of data, measurement, variable informations are available. But what we lacking, we does not know how to utilize this data. Or you can say we want to learn data mining. So multivariate analysis, there is a three thing. There is a big data. There is a lot of information available in the social media, website, in research platform or this. So you can see what do you mean by big data. Now, big data means in the form of 6V, you can remember. V means first V is a volume. So there are so many data is available in the social media. And we always say that if you apply any statistical there, and when you lastly mention about the limitation of any your research, that you one common limitation that we have done this research in small number of population. Okay, so what we do, it requires large number of population. So the big data, big sample size. So the volume if more, then multivariate analysis is very informative. Second way is the variety. Okay, now previously what we do research, if I suppose I'm taking the example that I want to do the any cap study. Okay, so what I do, I prepare a question, then I distribute to the my sample size, whether is a student or teacher. Now what is the variety? Now you create a Google form, social media. Okay, so there is a lot of improvement in the method of collection. So there are a lot of variety to conduct the research. Then come to the velocity. Velocity in the term of online survey platforms are available. There are different tools, online tools are available. Then fourth is veracity. Veracity in the means veracity, you can see that all of you are agree with when you do your research. There are some at the platform that at the some of the time you see that some data are missing. You lost the follow of the data. So what we do first, we exclude this missing data or lost to follow-up data. Now, then we come to the concept of per protocol analysis or intention to treat analysis. Now, in this also, if you don't want to miss the data, okay, or lost to follow-up, so there are the statistical techniques or the methods that you can consider carry forward. You assumption is made and you can fully include these patients assumption data and you can do the analysis. So this is the veracity which is considered in multivariate analysis. Of course, variability in terms of time, because the data are continuously changing. Okay, at the one period of a time you can do research, then after some time there may be variation in the same data. So the variability is considered in multivariate. So you can say time event series or research is considered in multivariate analysis. And the values in the term of what are the importance of the information. So you can see that there is a large number big data in the form of volume, variety, velocity, variability, value, and veracity. Second thing, initially our concept when we apply the statistical test, we only focus on statistical data. Okay. Now the major limitation, you can say that a statistical data that we only just what we do is we just describe our data and then we can some inference we can take, whatever the inference or interpretation. But now this model statistical is moved forward to data mining, means where you can more emphasize on the causal effect relationship. Okay, inference or interpretation is different thing, but in data mining or multivariate analysis you can establish a causal effect relationship. And third thing, same the causal information, we move forward to the decision making process. Now This is the common scenario, because I come across my PG student also. They have a very little bit confusion about variable and data. Okay. So the variable means it may be any characteristic or attribute which describe your measured or observation in study. Like example, suppose I am considered the age, blood pressure, disease status, or treatment. So it is my variable. Now the data type may define the nature of your variable. Suppose I am taking the example of disease status. Suppose, so disease status is my variable, but I am asking the patient whether you have a disease, yes or no. So yes and no is my data type. So it may be a diagnosis or data with this two option, yes or no. Then I can categorize the disease status, maybe mild, moderate, and severe. So the nature of the data is the categorical value. So the concept was that disease status is a variable, but when you collect the information in the form of dichotomous, so it may be a data of the dichotomous data, or if the categorical, so it may be a categorical data. So this is the major difference between variable and data. All of you know that mainly the whatever we measure quantitative and qualitative data. Quantitative maybe in numbers you can put age or weight. Qualitative you can does not count, just only you show that suppose eye color. So it may be a brown, green, blue hair color. Okay. In quantitative also there may be a continuous data and discrete and continuous. Now discrete means you can count or there is a integer number. In case of continuous, there may be not count, but you have to measure. This is the major difference between the discrete and continuous. So measure means it may be in the form of not integer, it may be expressed in decimal. So this is the major difference between the under the subtypes of quantitative, discrete, and continuation. So this is the main types of variable, whether you include the qualitative variable or quantitative variable. Now data types may be a categorical or numerical. So you can put a number or you just describe the category. This is the main two subtypes of data. Then in numerical, it may be interval and ratio, and categorical, it may be a nominal and ordinal. So name itself suggests category means nominal means it's provide the identity to something. Okay. So like the months, brand name, department name, whether the physiology, biochemistry department. Okay. So you have just name, you give the name to the department. In case of ordinal, ye provide the any order or rank like severity of the disease, mild, moderate, and severe. Okay. Now, what is the major thing in this categorical, whether it is a nominal and ordinal? Because we cannot apply any mathematical operation. Summation, division, multiplication, all these mathematical operation we can't put or on this categorical data. But in case of numerical data, because it is in number, so you can do some mathematical operation. So there is an interval and ratio. Interval means it is a one type of a range where there is an importance of absolute zero. This is a major difference between interval and ratio. So certain ratio, there is a certain absolute zero, and all arithmetic operations are, I think all of you are aware about these different types of data. So my point to highlight is the difference between variable and data. Now come to the univariate or bivariate descriptive. Now what do you mean by descriptive statistic? Whether you only just describe your data, you don't apply any inference or interpretation. Suppose I am considered one variable, then it become a univariate, and I am considered two variable, and it become bivariate at a time. Okay. Now what in descriptive statistic, we measure the central tendency. So average. And how my data is deviate from this central tendency. So central tendency, all of you know that mean, median, mode, and dispersion in the form of standard deviation. Sometimes let me put in variance also. Okay? Suppose I am collect the information about the age of 10 person, and I am taking the mean of this 10% and what is the deviation of the my information. Suppose age of 10%, how many value is deviate from the mean, median, or mode. So this is just you describe that among my 10%, the median age is this and standard deviation is this. So you just describe, and your data is only, you consider only age, then it is become a univariate. Suppose along with age, I am consider weight also per person. So age is one variable. Along with this, I am consider the weight. So it is my second variable. So this is the example of bivariate. Now here also what I do, mean age of the patient is this, standard deviation is this, mean age of the weight of the 10% is this, and standard deviation is this. So all you describe. Suppose sometimes in categorials, this is a numerical data. In categorial, what you do, you put the data in frequency. Here also what you do, you just describe your data. Suppose 30% is have a disease, 40% does not have a disease, like this. So if you describe your data, it is it is known as a descriptive statistics. Now in descriptive statistic, what you do, you estimate. Okay, we already see that inferential. Now describe, and you want to some inference you want to take, whether it is univariate or bivariate. So you can do the some estimation. So it may be some point of a time you can do estimation, or some period of a time frequently. So it is an interval. So there is a two thing, that the point estimation and interval estimation. Okay. Now why we measure central tendency and dispersion? Okay, because already all of you are aware about, all of you come across also, you apply t-test or whatever. Okay, so you have some hypothesis. So when you measure some estimation, whether it is a point or interval, suppose some as a point of interval, you can measure central tendency and variance, standard deviation. Okay, both are dispersion measures. Okay, but in case of internal, what you do, you can take a different sample or population. So when there is the role of confidence interval. Okay, so for single population, you calculate a confidence interval for mean or confidence interval for variance. If you have a two population, then what you measure, the mean difference or the variance difference, and you take the confidence interval of the mean difference and the variance difference. Then you put the hypothesis. So what are the steps you do when you apply any statistical? That first you decide your hypothesis. So you null hypothesis and alternative hypothesis. Null means H0 and alternate means H1. Then what you do, you infer a statistic, you find out mean or dispersion, and you find according to your data appropriate statistical test. Okay. Then depending on this, you find out the distribution when H0. Now, what is when? This is the very important. When you apply t-test, chi-square test, any test, then you accept that whatever the distribution your data is follow, or whatever the statistical test you use, then your assumption is that my null hypothesis is true. Depend this assumption, you apply the statistical that, then you find out whatever the static chi-square value, t-test value, and you can check the level of alpha, and you find out the p-value significant, and you, depending on tech, you can say that this is a statistically significant or not. Okay, and depending on this, you accept or reject the null hypothesis. So this is the inferential statistic. Descriptive means you just calculate central tendency and dispersion. Okay. Inferential statistic, you apply something statistical test where you assume that my null hypothesis is true and this is my data, whether it is a normally distribution or not normally distribution, depending on the t-test or mean Whitney test or whatever the test you apply. And you conclude that the significant or not significant, depending on this, you accept or reject the null hypothesis. Now, what is the difference between population and sample? So population can be infinite and finite. Classic example, suppose in some bowl, okay, I have put 10 balls. So 5 are red and 5 are blue. Okay. Now I'm starting experiment doing. Now in first I'm what in do, I'm taking the sample without replacement. Suppose I'm taking pick up one ball and I'm conclude what is the probability it become the ball will be red or blue. Okay. Suppose it become I have pick up the red ball. Then I keep apart. Then I'm second time I repeat this. So at one point of the I have pick up all the balls 10. Okay. So this is type of experiment where I am do the sampling, but I have not replaced. So it may be a finite population. Now, infinite population, what means that suppose I have first I am taking the ball, it is a red, okay, and note down that the in first observation, red ball, then again I put the same ball in the bowl, okay, I have not replaced. Then again, so there are infinite probability, okay, this takes ball, but there are infinite probability because it is not an experiment. So the real data in real world, what is happen? There are infinite population. What we do the research and the whatever the research project we do, we just only do the research and project only the sample, which is we taken from the population, which is a small part of population, and we assume that this sample is representative of population. Okay. And we normally we try to find out that we stratification is done and whatever the other method randomization is done. This all these methods are done to basically exactly represent our sample is represent the population, and that is why so there are less chances of variability in your data. So this is the major difference when you say that infinite population and finite population. So this is the example of experiment. In infinite, you can't do the replacement, or you can do the replacement, but in finite, it is without replacement. Now come to the multivariate descriptive statistic. Now what happened? All of you, I think I want to ask someone and you can answer in chat box. Have you come across this, all these things, what is known as that in max? Yes, any chat box? Yes, anyone can answer also. Your microphone on.
No, ma'am, I guess it's very new to all of us.
Okay, yeah. So what do you mean by multivariate? Okay. So suppose you have taken now multivariate at this point, you all are all clear that I have a more than two variable. Okay. So I'm just taking the next slide. Whether I am consider age, this is the one variable. Okay. Sex, it is a second variable. Weight, it is the third variable. Heart rate, it is the fourth, and blood pressure is the fifth. So I have giving the example. This is the my 5 variable. So this is the multivariate. Now I want to describe, but what I do, I have calculate the central tendency and dispersion. Okay. Now, what is the role of multivariate? Suppose you have a 30, 100, 300 data, then it is easily calculated in Excel and this thing. Okay. But suppose you imagine that this data in the form of 10,000, 20,000, 1 lakh. Okay. All these 5 variables. So here there is a role come to the multivariate. This is known as a matrix. I don't know because at present, whatever the medical student take in admissions, they are from the B group, biology, and they may be not aware about some mathematical concept in 11, 12. But we are from this era where we have a common group, not A and B. So this is a matrix. Now I will just clear what is it. Suppose this 1, 2, and P. So what is this? It is the number of observation. So suppose my number of observation means what are the number of patient you can say. Suppose I have a 10 patient or 20 patient. Okay. Let's example, we take the 10 patients. So X1, X2. So the patient number 1 and age is my one variable. Okay. So what I am do, patient number 1, I have collect the 5 variable: age, sex, weight, heart rate, and blood pressure. Then come to the second patient or observation. On the second observation of the my age, sex, weight, heart rate, and blood pressure. Then third, now into the name may be N. Whatever do, N may be 10, 20 or whatsoever. Okay. So this is about the N means number of observation. Okay. Now, this is a column. Okay. This one is a column. This is my observation. So this is the patient number 1. And there is what is written 11. And again the second column 11, 12. Then come to the 30, 30. This is my P. P means observation I denote as a N. P means my variable. So here my variable how many? 5. Okay. So my P is 5. Now what I have put this 1. This is my observation. So there is a 2 digit X11, X12. Now how will you read this? First one is the observation and second one is your variable. So my X11 means 34. The first variable, first observation. Okay. Then come to the X12. So the first one, it is a what is? It is a observation, my first observation, but which variable? Second. So it may be the second observation of the sex is female. Then come to the X13. So it may 50. So the first observation. So ultimately the summary is that this row is the all information about the how many variables we included for the first observation. First, second, third, fourth, fifth, infinite, whatever the variable you include. So this is the data represent like this in whenever you use, because the multivariate analysis you have to do in the softwares. Okay. So here you have to prepare the data for the analysis. So this is the initial preparation stage. Now come to the second. So this is my second observation. So 21. So second observation, first variable, second observation, second variable, second observation, third variable, like this. So this is going on in lakhs, 10 lakhs, whatever. So this is the concept of matrix. And if you apply the rules of matrix, this is the equation. If you calculate according to the calculation of the matrix, you obtain 5 value. This 5 value you obtain. And this 5 value is what? This is the mean of age, mean of sex, mean of weight, mean of heart rate, and mean of blood pressure. This is the central tendency you can measure. This is the mean. Now, depending on this, whether you want to measure, so this is called the vector, matrix and vector. So in single univariate and bivariate, you can easily calculate in Excel or even manually also, okay, mean or whatever. But in multivariate, you have to express the data in the form of matrix and vector, and your whatever the output when you apply the statistical software, you just click that I want to just calculate multivariate descriptive statistic, then it come under the mean vector. Now, what happens when you consider more than two variables, then you have to some importance weightage is given for the covariance in the presence of one variable, how other variable is react, and what is the association between the variable. So this is the most important thing, covariation and correlation. They are simultaneously measured. It is not like that first I measure. Suppose there is a 5 variable. So what I do, I am taking first 2 variable. What is the covariance between the first and second variability, and what is the association, whether it is a correlated or not. But what happen when I am consider first 2 variable, suppose age and sex, then what I have do, I have not considered the other variable at the same time because I am neglected. But in multivariate analysis, what they do, when they apply all the variable at the same period of a time, and they calculated in the form of matrix and vector, they consider all these covariance and correlations. This is a correlation matrix, and if you can say this one, the arrow cross, this is Q, this is a covariance of population. That is why it is written as a sigma. 11, 22, 33. Now, what is the variability? The same person. Suppose, what is the variability of myself with my? So, but natural, it is always a correlated. The association is correlated and variability. So when you apply this matrix in the calculation of covariance and correlation, this value are always become a 0 in covariance because there is a no variability, and correlation is become a 1 because it is exactly correlated. Okay, because it is the variable itself along this correlation is occur. So there is a no chances of variability. So it is when you apply in statistical software multivariate statistic, then the data is in the form of this, and you see that this cross line, when you calculate covariance, it become a 0 all 11, 22, 33, 44, 55, whatever the number of your observation. And correlation, if you calculate correlation, this all cross row or intersect, it become a 1 because it is the observation is correlate with the self. That is why the covariance is 0 and correlation is the 1. Okay, so what I have do, I have take the multivariable data, more than 2 variable data, and I have just described the central tendency in the form of a vector, and here also you can variance you can calculate, and you can calculate covariance on correlation. So this is my multivariate descriptive statistics. Now come to the ANOVA analysis of variance. All of you know, okay. But ANOVA, it is a univariate statistics. It is not a multivariate. Now why? I will see later. So the basic concept, when we apply ANOVA, we assumption is that whenever we have a more than two population, means either 3 or more than 3, and what we ANOVA, we learn the number of variable, we consider only 1. Suppose I am examples, I want to check the effectiveness of different medication on patient's outcome. Okay, so what is the my impact of various treatment methods on the recovery time? So what is the my purpose treatment? So treatment is my variable. There is a 3 different types. Okay, 3 groups, And variable is my outcome is the recovery time. I want to measure the recovery time between the three group, okay, three population. Okay, so population, the one population receive A treatment, second population receive B treatment, third population receive a, but what is the my main variable? Treatment. Only the treatment I have considered. Okay. The one way ANOVA test, though this is the one thing that only we consider one variable. Suppose I am checking the students exam performance based on the teaching method. Suppose some students, they have attended lectures, so what is the improvement in score? Second group is the interactive workshop, then what is the exam score, and third one is online learning. Okay, so only I have learned included teaching method. The teaching method is my only variable, outcome is my exam score, but in variable there is a three group, three method. So the population is 3. So here what happened? Teaching method. Now, whenever you come across ANOVA and further higher statistic multivariate, there is a two terminologies very commonly covered. Independent variable and dependent variable. So teaching method, it is the independent variable. Okay. So here my independent variable teaching method, which have a 3 group, and my exam score, or you can say that it is a outcome. It is a my dependent variable, which is depend on which teaching method student have adopted. So there is a two terminology is very come across, dependent and independent variable. Now, one-way ANOVA is very effective when you analyze the impact of single factor across the multiple group, making it simple to interpret that you have what you do, you just do the teaching method, my one variable, 3 group. Okay. Now, what I am checking, lectures, how many exam score student attend lecture, how many exam score student attend interactive score, how many score in online teaching. Okay, so I have compared the score of these 3 methods. Okay, so this is called one way ANOVA. Now come to the two-way ANOVA. Now I am adding another thing. In two-way ANOVA, there are 2 independent variables. In first example, what is my independent variable? Teaching method. I am consider only teaching method. Now, along with teaching method, I want to emphasize or included what are the study techniques, whether the patient use any different study techniques. And then I want to know that whether there is any jointly teaching method and study technique will affect the student performance. So here my 2 independent variable, teaching method and teaching technique. Okay. So the here what there are 2 or more group, but the independent variable are 2. So this is come as a two-way ANOVA. And third is repeated measure ANOVA. Suppose I am in the start of and the end of first term, I have collected the score and see the which teaching method is important. The same group of student, I am again at the end of second term. So what my measurements are repeated. So in this condition, I have not a single simply applies one way or two way. Okay, I have to apply repeated measure ANOVA. Okay, so this is the best example that suppose in the before the program or before the medication. Okay, what is the baseline characteristics? Then after 1 month, after 6 month, 3 month, 12-month follow up. Okay, I am giving this example of the weight, any diet weight loss program. So at a baseline, what is the weight of the patient? Okay. Then after sometimes the same person, how many weight, what is the weight at the end of 1 month? What is the weight of 6 months? Okay. Now I want to simultaneously analyze the data of baseline 1 month and 6 months. Then I have to go for repeated measure ANOVA. If suppose I want to analyze the data on only at the end of only baseline or 1 month at a one period of a time, then you can go for one way ANOVA. But the time you have to include it, because the time period is very important, because the same person you measure the weight before starting the any dietary modification or what, after 1 month what is the weight, after 6 months what is the weight. So the same person you have to follow some period of a time. Then you want to analyze simultaneously all the data, then you have to go for the analysis of variance or ANOVA, and in ANOVA specific repeated measure ANOVA. So I think all of you have a clear what do you mean by one way, two way and repeated measure ANOVA. But here the one thing is important, that here the outcome variable might. Okay. So what is the outcome, or you can say that this dependent variable. Here the dependent variable is the exam score. Okay. That is why when your dependent variable or outcome you measured, it is a single. It is a known as a univariate. Sorry for the disturbance. So this is the univariate ANOVA. Now come to the MANOVA, multivariate. So in univariate, when there is a your outcome or dependent variable is 1, exam score. Okay. Then there is a you apply the ANOVA. Now suppose your population is 3 and more than 3, you have an knowledge that you have to apply the ANOVA. But what happen when you have a more than 2 variable? You have here that there is a what happened, there is a study technique and teaching method. 3 population and you consider only 2. Now more than 2 variable and more than 3 population, then you have to go for the MANOVA, multivariate analysis of variance. The classic example, suppose the impact of different treatment types of multiple patient outcome. Suppose blood pressure, cholesterol level, weight simultaneously. This is very important. In multivariate analysis, you can't compare only cholesterol and a blood pressure at the one period of a time, and you neglect the weightage of the weight of the patient. So in multivariate analysis, what happened when blood pressure, cholesterol and weight, all the parameters, all the variables are simultaneously analyzed and given weightage to determine what is your outcome of the patient. There is a, suppose I want to compare the score of the maths and English based on the patient's the anxiety level, on the test anxiety level. So here what happened, your 2 dependent variable, maths exam score and English exam score. This is the 2 dependent variable, both measured in suppose any Likert scale or scale you use, and your independent variable would be test anxiety level, which has 3 groups: low stress, moderate stress and highly stressed. Okay. So here what happened, you have to apply the either 2 or more than 2 variable, and population is 3 and more than 3, then you apply the multivariate MANOVA. There is a no role of ANOVA. You have to consider the MANOVA because your variable is 2 or more than 2. So this is the, you can easily remember, population is 2 and your number of variable is 1. So commonly what we use the t-test. Okay. Then if normally distributed or more than 2 or 2, you can, this is the one type of modification of t-test, Hotling t-square. Okay, this is the hypothesis. More than 2, so 3 or more than 3, so 1, you can use ANOVA, and your number of variable 2, you can consider the MANOVA. Now the important thing is hypothesis. What is the hypothesis? So because we already, all the statistical tests we apply, we ultimately what we conclude, depending on the significant level, we consider as a hypothesis, that I accept the hypothesis or I reject the hypothesis. So suppose there is a your single population, okay, and you apply any statistical test and you see that Okay, whether suppose I am taking example, any new drug, what is the effect on blood pressure? Okay, so suppose I am saying that my new drug pressure, they lower the blood pressure, medication, lower the blood pressure by 10 mmHg. Okay, so what is my main hypothesis is that what I assume that what am I doing my experiment on sample. So my sample mean is equal to the population mean. Okay. So this is a hypothesis of two population. So suppose single population, then I say that my sample population will represent the actual population. Sample mean is equal to population. But when more than two population, then I say that mu1 is equal to mu2. This is my null hypothesis. Both are same. And alternative hypothesis, both are not same. Okay. So this is the concept of, now suppose if there is a more than three population, then the hypothesis will be mu1 is equal to mu2 is equal to how many type of population, three population for. But here, what is the alternate hypothesis? At least for one pair. When I compare mu1 with mu2 or mu2 with mu3 with mu3, it is not equal there. Okay. This is the scientific or thumb rule of hypothesis, whether your population is two or more than. Okay. And this is when we said that we accept the null hypothesis and we reject the null hypothesis. Basically, in scientific or statistical term, we prove this. Whether we accept this, that mu1 is equal to mu2, or whether we reject that mu1 is not mu2. Okay. So there is a tricky whether it is accept or fail to reject null hypothesis or this thing. Now, all of you know that today's model and modeling. So basically, I want to highlight what is the difference between model and modeling. Model means you have make any model which mimic the reality, which explain your some pattern or regularity of any phenomena or data, and can be extended to any law, and which ultimately when you develop the model, it ultimately converted or extended to any law and theory. Now, modeling is a technique or process of building a model. Okay. So modeling can be physical model, you can prepare, you can make a mathematical model, you can prepare a statistical model. Because nowadays all this machine learning and AI, what they do, they prepare a statistical model. Now, how we approach the model building? Because ultimately we have some practical problem. We find out, we observe the data, we find out some pattern, we identify some practical problem so what we do, identify the problem, then we convert this problem in the form of statistical problem. Now, in the form of statistical problem means you generate any hypothesis. Okay. Then in depending on statistical probabilization, you find out any statistical solution. You apply the various statistical tests and you conclude any conclusion. And depending on this conclusion or your significant level, you find out some practical solution. So this is the cycle of the model building. You find out the practical problem, convert into statistical term, apply statistical test, and you find out any solution. So these are the main thing today's topic. Why we more emphasis is given in univariate and bivariate, because this is very important, that what is the difference between the univariate, bivariate and multivariate. So multivariate model, I can say that multivariate analysis is the sea, पूरा जो समुंदर होता है ना ऐसा है. So I am just only present is the some drop of information, because it requires a lot of lecture series or on-hand training and workshop. Okay, so I am just only giving the brief introduction, but it is a very helpful, because the main purpose why I am taking the lecture is that you start using multivariate analysis. So you just think that my data is like that, I can apply this multivariate analysis, I can go for the large data or big data. Now, so depending on your model or the method, there is a dependence technique or interdependence technique. Now, what is dependence and interdependence? So in dependence technique, you presume that in which a variable or the set of variable is, you can clearly identify which is my dependent variable and which is my independent variable. Like in first example, I have given teaching method. So it is my teaching method is the independent variable and the exam score is my dependent variable. So such type of a data where can you clearly label that this is 6 variable my independent and these 2 are my dependent, then you can use the dependent methods of multivariate analysis, which is MANOVA, regression, path model, structure equation modeling, SEM, logistic regression, and discriminant analysis. Now, sometimes there are some data where you can't label. Okay, which one is my dependent, which was my independent. So you have a no clear idea. Okay, which variable I have to put as an independent, which are my dependent variable. Then and even though you want to carry out multivariate analysis, then you go for the principal component analysis, factor, cluster. Another is under subtype path analysis. Okay, so depending whether you have a clear my variables are dependent or independent, you can't identify, you go for the interdependent method. If you clearly identify my variables are dependent and independent, then you can go for the dependent method. Now, depending on the number of variable, suppose interdependence technique, then you go for the factor, cluster, multidimensional. Now, in dependent, there is a, depending on your number, level of, suppose your data, non-metric or metric, interval ratio, then your metric data or numerical data, you can go for correlation, bivariate, ANOVA, MANOVA, canonical. Or suppose your data is non-metric, so it is a nominal or ordinal, then there is a discriminant conjugate. So it is a same classification, the method remains same, but the way of presentation is depend on the number of variable and what are the type of variable. Whether it is a metric, non-metric, data is nominal, ordinal, interval ratio. So they have differentiated the techniques according to the data type. Here also the same number of variable, one variable, more than one variable. If you want to utilize dependence technique, then the method you have to select according to this. And if you have not clear that my data are dependent or independent variable, clearly identify, then you go for the interdependence technique. And variable interdependence, there is a some common scientific rule. So depending on variable interdependence है कि नहीं और inter object similarity है, उसके according तुम्हें आपको ये method select करनी होती है. So today we only focus on factor analysis, regression analysis, and principal component analysis. There are so many methods, but this is very commonly used in medical research, and I've come across in the medical research these 3 common methods. First come to the regression analysis. Now, what is the regression analysis? It is assess how well the independent variable explain or predict the variation in each of the dependent variable. There is a 2 types, simple regression and multiple regression. Simple means your y. So dependent variable उसको हम बोलते हैं y. It is denoted as a y. Okay, dependent variable y होगा. You can relate outcome variable. आपको क्या measure करना है? Suppose I want to measure my outcome of the patient depending on the treatment. So outcome in the form of reduction of blood pressure, hospital stay, outcome may be a hospital stay, whatever the outcome, it is your dependent variable, which is depend on the x, which is my independent variable. So simple regression में क्या होगा, 1y होगा और independent variable भी एक ही होगा. दोनों एक एक है, the one dependent, one independent, and you apply regression analysis, it is known as a simple regression. Now, what do you mean by multiple regression? Same dependent variable y रहेगा, but at the same period of a time, I have considered more than one variable independent. So X may be more than one. So it is a multiple regression. So it is the number of Y that tell you whether it is a univariate or multivariate model. So here also this regression, I am simple and multiple, but dono mein what is the common feature here in both category? My Y or my dependent variable is 1. So this simple regression and multiple regression, if you apply, it is come under univariate. X may be more than 1. So if 1, then simple, more than 1, multiple. But multivariate jab when you pronounce or multivariate analysis, then your Y is more than 1. Then it become a multivariate. If you consider 2, you can get bivariate, and more than 2, you can consider as a multivariate model. So all of you heard about simple regression and multiple regression. So only the important thing here I highlight, multiple regression and multivariate regression, both are different things. Multiple, you have a one dependent variable, and in multivariate, you have a more than one dependent variable. So suppose as a doctor, I have collected data on cholesterol, blood pressure, weight, and also collect the data on eating habits of the subjects. That's how many ounces of red meat, fish, dairy products, or chocolates they are consumed per week. Then I want to investigate the relationship between the three measures of health with eating habits. Okay, so here I want to simultaneously eating habits, eating habits, how it relationship, what is the relationship with eating habits with the cholesterol, blood pressure, and weight. And I am not checking that only eating habit at a one point of time with weight. At a one point of a time, I am checking what is the relationship of eating habits with the blood pressure. I am checking all eating habits with all three parameters, cholesterol, blood pressure, and weight. Then I have to apply the regression analysis. I am taking this, you can go through or note down, or you can go through this article. Here they apply multiple regression model to analyze the total LOS, length of hospital stay, of the patient which undergoing laparoscopy, this anal laparoscopic appendectomy. And this is the, they apply the test, multi-regression. Now, what if you see this table, what I am showing you, if you apply multiple regression in any software, what is your output of the data? Okay. So what is ultimately your conclusion or result come? So when you apply this multiple regression, your data, you can find out this table in your statistical software. So the first one, it is a variable. Okay. So this is the intercept. Then, so my main dependent variable is length of hospital stay, LOS. Okay. And this presence of complication, diagnosis, gender, age, morbidity, and then heart disease, diabetes, all are the independent variable, which is a more than 2. Now, what do you mean by unstandardized coefficient? This is the remain same, whether you use SPSS, you use GraphPad, you use any statistical software. When you apply multiple regression, then the table, there is a 3 terminology which commonly used, the unstandardized coefficient. Now, what is the interpretation of this unstandardized coefficient? So they represent what is the change in the dependent variable. What is my dependent variable? Length of hospital stay. When I increase my independent variable 1 unit, then what change occur in length of hospital stay? Suppose I am considering presence of complication minus 3.949. Okay. And if you go through regression, there is an equation. The basic principle is y is equal to a plus bx. A is the intercept and b is the beta coefficient. Okay. So what I want to do is, suppose I am considering presence of complication one independent variable. Okay. If I put the value in equation of this presence of complication independent variable of this, okay, then what is the change occur in hospital stay? Now, when I do this, I consider that all these variables remain constant. There is no change in this other variable. So this unstandardized coefficient, they reflect this. Suppose I am considered gender. So what change occur in gender? Suppose if gender is male, then what is the length of hospital stay? When gender is female, what is the length of hospital stay? Considering all other variables are constant. So unstandardized coefficient is repeat this. Second is standard error, which reflect the precision of your observations or your method. Okay. So, but nature standard error is a smaller value. It suggests the more precise. Now, again, there is a standardized coefficient beta. Now, what is this? Is the unstandardized and this is the standardized. So this is the based on the regression principle. Standardized coefficient beta means when you, suppose I'm taking first example, presence of complication. Unstandardized coefficient is minus 3.949 and standardized coefficient is minus 0.344. Now, when I consider standardized coefficient beta, at that time, when I change this unit, independent variable, then what change in the dependent variable? At that time, the assumption is that all other variables have a zero mean and standard deviation is 1. So this is all. The main difference is unstandardized coefficient. Here you assume that all other variables are constant, means they have some mean and standard deviation average. But in standardized coefficient beta, you assume that all other variables have a average standard central tendency is their 0 and their standard deviation is 1. So this is the reading of standardized coefficient beta. And we are more when we assume, because we apply regression analysis, so we assume the principle of regression analysis that our data or they have follow zero mean other variable and standard deviation is 1. And this is the p value depending on the t value, the significant and non-significant. Now, what is the conclusion? So whatever the data, okay, ultimately what regression explain, which variable explain the variability is more, or which variable I have to consider. Suppose length of hospital stay, I have a 8 to 9 variable, but it is not equally contribute to the hospital stay. Some may be 10%, some may be 20%, some may be 30%, some may be 40%. So which one for my observation or according to my distribution, suppose I want to consider only the significant result. So what this regression will tell me, that whatever the significant result, because this result is based on the variability. So they consider the variance, covariance, variability, and correlation. All the principle and analyze, and they show me the result which independent variables are highly significant. So I have to consider only this variable independent. Suppose here 0.01. Okay, this complicated diagnosis. Then this one, age important, presence of complication. So I have considered this variable or factors are more important to determine hospital stay as compared to other variable. So this is the interpretation of this table. So this is about the regression analysis. Now come to the factor analysis. Now what we see in previous slide, factor analysis is apply where you can't label any variable as a dependent and independent variable. Okay. So this is the second thing. And factor analysis mostly used in the immeasurable things. Some information you can't put in data, or I can say that qualitative research. So the main principle of factor analysis, that you have a lot of information and you have to condensing the information or concise in a smaller set of variable. Okay, then what this analysis do, multivariate analysis or statistical software, a lot of immeasurable information they concise and they convert this variable into the smaller set of variable, or you can say factor with a minimum loss of information. So this is come the factor analysis. So I will explain example. Suppose a company wants to understand what makes the customer happy with a new product. Okay, any product is launched, and they want to find that what is the satisfaction of the patients or sample. How now? What is the important problem here? How you measure satisfaction of the customer? You can't label as a 1, 2, 3. Okay, how you measure the satisfaction? So you ask the questions, different types of question. You can presume that okay, this question related to satisfaction. So patient take anything, I am accept or reject, or I convince or not. So such type of a qualitative research, the factor analysis is very important. The structure of the correlation, it is the main important thing among the large number of variables. So mostly the factor analysis apply in questionnaire, cap study, social media user, test score. So some questionnaire or cap study, or when you use score, so they define some set of variable and they integrate it and they convert it into the factors or components. This is an example of a factor analysis. Suppose there is a factor analysis of a done what? Patient-centered cancer care measures. And they have to find out okay, how improvement in the patient's experience assessment, they find out. So what they do in factor analysis. Another example I can give for the factor analysis. Suppose I have some observation that some person, okay, they break the rules. You can see that when you cross the roads, okay, when there is a traffic signal, when there is a orange or red light, you have to stop. But there are some persons, they break the rule and they go, even auto rickshaw or motorcycle, okay. So what we thought that this such type of a person which break the rules, okay. So what is the reason behind this break the rule? So we thought that the person nature is like this, they have a anxiety, they have a risk taking behavior there. So this thing you can't measure. You can ask the question to the such person and then you conclude that such type of a personality, they always break the rules. So ultimately what I want to convey, that something you can observe but you can't find out the root cause analysis. Okay, for this what you do, whatever you find out, what is your finding, such break rule person. I have collect the information from the older person which break the rules. Then I study their behavior, their nature, and these things. So what is my observation? Depending on my observation, I prepare some set of question, and this set of question I am do the some factor analysis, which converted the structure. There is a lot of, suppose I am asking the 25 to 30 question, and they converted into the domain, suppose is converted into 5 factors. Okay, and then I indirectly I study the nature, my observation through factor analysis, and I do the root cause analysis. So in this factor analysis, in this research article, what they do, they consider 2 domains. What is the physiological experience? So they study physical, emotional, and psychological aspect. And another is treatment domain. So what is the treatment is effective or not? The patient care is communicate properly or not for the this thing. So there is a 2 domain, and there is a lot of question there as you can go through this article also, and they do the factor analysis. Now, whatever they suppose there may be a 50 to 25 question, and they run the factor analysis. So what the multivariate analysis do, they define, or they can do they converted the data into 5 factors. One is quality of life, one is social support, because there are sometimes you can't able to identify which question is related to which thing or this thing. So you can do the factor analysis. So the 25 question they converted into the 5 factors. So this is the output of the result. When you run the factor analysis in your data, so factor, they converted, it may be a 5 factor model. It is depend on which one you want to, if you want to 4 factor model, if you want to consider only 3 factor, depending on this, they, now how it decide, because it consider the all the variability, covariance and correlation, all the consider simultaneously, and they present your data 25 questions of the 10,000 patients into the concise in the form of 5 factor. Now there is a first is eigenvalue. I think all of you know or don't know eigenvalue. It is a mathematical principle which is applied in algebra. Okay. So this factor analysis, the main principal work behind factor analysis, it is a main eigenvalue and Eiger factor. Okay, you can Google it, and if you want to go for detail about eigenvalue. But what is the importance in this factor analysis? It represents the amount of variance in the observed factor 1, which is explained by other factor. Okay, or in short, you can say that each eigenvalue, if more than 1, you can consider it is a significant. So I think all factors have an eigenvalue more than 1. Okay, now which factor I have to consider? So here the thumb rule, the more eigenvalue, which is the greater, yeah, I have to consider this. So the eigenvalue is more is in factor 1. So I have only in my conclusion or result or my conclusion, I only focus on factor 1 because it have a highest eigenvalue. Okay. Now, percentage of variance, it represents the variability which is explained by the factor 1. So, factor 1, 52%, factor 2, 10%. It is a percentage presentation of a variation of a data which is explained by the factor. And the cumulative variation, it is the addition. So, suppose I am consider factor 1 and 2 only. Other 3 are not included. Then what is the chances of variance or variability? There is a 62%. Now in 62%, I am adding third factor. Then consider all these 3 factors, the variability explained by 71%. Okay. So this is the cumulative variance. And Cronbach alpha, all of you know about, it is the reliability. So whenever you do any questionnaire survey or CAP study, you have to only identify reliability. So they, along with this factor analysis, they also provide the reliability of your questions. Okay, so factor one, whatever the question come under factor one, they have a reliability is higher as compared to other. Okay, so this is the interpretation. So what is the my concern? Whichever the eigenvalue is more, the factor analysis result, I have to consider only this factor. Now among this factor, whatever the domain I have included, okay, depending on this, I have to check the association. Different statistical tests are applied in the factor analysis, and depending on this, I have to conclude. Okay, so the important thing in factor analysis is that result depend on the whatever the test you apply. In factor analysis, not depend only on this factor analysis, or you just end here. You have to this tell you that which factor I have to include it. Okay, so the what the factor one may be combine 5 questions. Okay, but in this 5 question, 2 question from maybe a physical question, 2 may be a psychological question, and 1 may be any other question. Okay, so depending on these 5 factors, which question here are more important, so it is they converted into factor, and they tell you that you go for factor one. So this is the factor one, means whatever the question they, all this information come in the statistical software. So this is, so ultimately you have to know that factor analysis, what happened, I have a lot of question. There I prepared 25 question and I asked the 100 patients 25 question. Now I am confused what my dependent variable, what is my independent variable. I don't know anything. So you can't do. So you, and you want to apply the multivariate analysis. Then it is a by rule that if you don't know whether it is dependent, independent variable, then interdependence technique. So you go for the factorial analysis. And this is a, if you go come across any research article into factor analysis, they always represent the data like this. Okay, it may be a factor one, factor two, depending on 4 factor, 5 factor, 7 factor, different factor models are available. Okay, you have to choose according to your, what is your types of data, what is your objective of the study. Then come to the third principle, component analysis. It is a unsupervised multivariate analysis technique that transfer a set of data, a variable, into a new set which is uncorrelated variable known as a principal component analysis. Now, all of you are thought that okay, these are the very hard thing. The only thing is that whether I want to use factorial analysis, regression, all things are available just as a one click. If you go through SPSS, just you select your data, you just transport your data, you select the test, all thing will come and automatically come. But what is the more important here? You want to know that this thing, whether this is applicable to my data, factor analysis, regression, or principal. Okay, it is a fit, then I want to apply. Now, whatever the result come, I have to interpret. Okay, so in factor, what happened? There is the data is converted into factor. Here, the data is converted into the component. This is the only difference. So that is why it is known as a factor analysis and it is known as a principal component analysis. And this is a very important principal component analysis. Use this method in machine learning. All of you heard about machine learning. Today it is booming, machine learning. Okay, there are so many courses, AI in machine learning or this thing. So they utilize the principal component analysis. Suppose the example, disease diagnosis and subtiming. In this technique is used in which principal component usually used in, suppose in breast cancer. Okay, you have to develop some model to predict the diagnosis in breast cancer data set. So what do? You take the data of breast cancer, lump radius, texture, perimeter, all the minute things. okay, genetic variation, all these things, subtyping, you develop, you run principal component analysis and you develop. Now you feed the data. Suppose my patient, the lump radius is this, my texture is this, parameter is this, genetic is this. So what are the chances that person have a breast cancer? So this principal component analysis mainly used to model, or you can, all of you known about common advanced technique, predictive analytics. Okay, we are taught about multivariate analysis. Now, multivariate analysis also, the other name is predictive analytics. You can predict the thing. Okay, okay. Suppose patients have a this thing, then in future it can be chances that it can be developed. Okay, so predictive analytics, the most commonly used method is the principal component analysis. Then risk factor identification, diet and lifestyle. Now, I think in recent last day in WhatsApp group, the one doctor, cardiologist in Chennai and died. Okay, all are assumed that they have established that if your lifestyle is not regular, not proper sleep, not habit good, these hours of work, then there are chances of this heart attack and sudden cardiac arrest. Now, how they conclude or they reach this conclusion? So someone have collected the data of the doctors, okay, or stress level or anything, and they can do this multivariate analysis and developing the model. And they say that there are chances, suppose patient of this, then there are chances that they can develop cardiac arrest. And if you come across any research article, and there is a in method section, if they mention principal component, you have always seen this figure. This is the scatter plot, but it is in 3 dimension. Okay, it is principal component analysis. I'm giving the example here. The person have do the research on the congenital adrenal hyperplasia. Now, what they do, they take the patients of congenital adrenal hyperplasia and they do some measurements, some clinical parameter and some hormonal ratio like this, endosterone, testosterone. Okay. Now they divide, what they do initially, they divide the patient in congenital adrenal hyperplasia who have completed the full treatment. Okay. And some patient they बीच में छोड़ दिया था, they left over treatment and again start treatment. Okay, so what they do, they divide it in 2 groups. Okay, and they collect the information about clinical parameters and hormonal issues. Okay, now depending on, they run the principal component analysis, and whatever the information or data they put, they converted into the 4 component, PC1, PC2, PC3 and PC4. Okay. Now they want to find out that this hormonal assay, they do the comparison between the patient which regularly take treatment and patient which don't regularly take the treatment. Now, will it be able, this, suppose I am only focusing on the hormonal assay, not consider the clinical parameters. So whether these hormonal assay values, it differentiated between they develop a model that they consider the classical cases of congenital adrenal hyperplasia and non-classical congenital. So they develop the model depending on this principal component analysis, that depending on my hormonal assay, which I have collected from the patients of congenital adrenal hyperplasia, whether they differentiated between the classical congenital adrenal hyperplasia and non-classical. So depending on this, they run the principal component analysis and they develop some model. And then they find out that suppose patient here, how will you interpret? Again, same proportion of variance, जो variability करते हैं, cumulative variance and eigenvalue. So the by thumb rule, whether it is a factor analysis or principal component analysis, eigenvalue whichever the factor or component have a higher eigenvalue, you have to consider only this. So I have considered PC1 because the eigenvalue is the higher in classical, and in non-classical again here also the PC1 is high. Okay. Now so this principal component analysis tell me that the PC1 now again in this is a correlation. Now, all of you know that correlation +1 is the best correlated. So, which have a near to 1, it is a 7-OHP. So, among the all hormonal assay, if I want to give more weightage or which is more correlated with my patient diagnosis, it is the 7-OHP measurement hormonal assay, because it is a highly correlated. Others are negatively correlated and association is very poor. But this is the 0.93. So in my model, whatever I develop the model, the more weightage is given on this. Now, how I will prove? Because I have run this principal component. Even if I don't do any statistical analysis or multivariate analysis, only on the description, I cannot say that 7-OHP is the standard hormonal assay method for diagnosis of whether it is a classical or non-classical congenital adrenal hyperplasia. Okay, so in factor and principle, the eigenvalue mathematical principle and eigenfactor is commonly used. In regression, the matrix is commonly used. So this is the basic principle behind these three commonly used multivariate method. So why purpose of multivariate modeling? Because ultimately, whether we use the descriptive or inferential statistic, what we are leaking is the causal relationship. We can't damn sure to causal relationship and the decision making process. And that is why initially there is a descriptive phase. We use the descriptive statistic, then we inferential or explain the variability. Now we at the current era where the whole thing are on the basis of prediction. Prediction means decision making. So model making. And due to this, there is a role of multivariate analysis. So this is a very current concept, and sorry to anyone can, I just want to ask the last question to conclude my session. Can anyone tell me what is this figure? Anyone can unmute and tell me. Just I am giving hint that it is a representation of any famous Hollywood movie. Yes, anyone?
Matrix.
Yeah,
Yes,
matrix.
matrix. All of you have a neon. Okay, so पीछे से ऐसे पूरा 0 1 2 3 numbers जा रहे. Actually, the concept is different in matrix because they assume that the parallel world is running. Okay, there is also assumption, and they predict that in future that may be happen. ऐसा नहीं हो सकता है, इसलिए in present they can do. So you can correlate with only my message to convey all of you, the participant, is that there are lots of data. But only the thing is lacking, we does not have a knowledge that how these data are utilized and which statistical or apart from the univariate and bivariate, just focus on multivariate analysis. So you can conclude or decision making, some maybe make a model also. Okay, so there is a lot of data or information in social media in real world. Just they are continuously flowing and they are continuously change also. Okay, so maximum you can utilize this data through multivariate analysis. So at the regarding this slide. This is why I put this figure. Then I conclude my session. Just only I want to first thanks Dr. Pawar sir, which is the mainly the founder of this National Medical Teacher Association and Gujarat Pharmacologist United Association, which is the main founder and coordinator of Pawar sir. So I am very grateful and thank you the Pawar sir to giving me this platform and opportunity to discuss this important topic with all the participants. Then Dr. Anupama Desai madam also, which is a main the president of this GPU and Gujarat Pharmacologist Association. Second, all the participants, thank you for your listening me and just attend this webinar. Okay, I hope that because all the things I is not able to cover in 1 hour lecture, just kindly just give the brief introduction. But I thought that some of you can take a lead and start using multivariate analysis, because I am also in learning phase. Okay, because I have some patience, or I love the statistic, so I have also learned the things. And this platform is also one platform that through this platform I also request you to all of you that if you have any some query, later on you can contact me. At present, all of you, if you have any query, you can ask me. Okay. So with this, I am thanks to all of you. Thank you very much.
Thank you so much, ma'am, for such an informative lecture. Now, I just want to request the participants, if anyone has any query, they can enter their query in the chat box, or they can even unmute themselves.
Yeah.
Okay, ma'am, there are no queries in the chat box. Ma'am, I have a question. Can I ask?
Yeah, sure. Mm-hmm.
Ma'am, is there any limit in multivariate analysis of variables which we can
No, there is a no. It may be in anything. It may be a 10 variable. Anytime, many variables you can consider. There is a no limitation.
Okay.
Because why I ask you, because regarding I myself, I said that I have used SPSS. Okay, statistical majority we use. Some are use GraphPad or this thing, but there are some advanced software like MATLAB. I have come across this thing which is mainly on machine learning. So there is a ये मैट्रिक्स का जो दिखा रहा है ना, उसी टाइप में होता है कि so many variable, any type of variable, any count you can calculate.
Okay.
There is no limitation of any variable.
Yes. Thank you so much, ma'am.
But as a personally, I believe, I thought that what we are lacking, first we have some hesitation. Whenever you come to any statistical test, now our PG student or we also as a faculty, कि यार ये क्या स्टेटिस्टिकल सॉफ्टवेयर, अभी इसको हम क्या इंटरप्रिटेशन करें, कौन सी टेस्ट लगाएंगे, कि वो सब कंफ्यूजन होता है. अभी वो भी थोड़ा सबको अभी काफी ऑनलाइन कोर्स सब करते तो पता चल गया है. बट स्टिल आई हैव थॉट दैट के वी आर सम लिमिटेशन रिगार्डिंग सम univariate, bivariate, t-test, ANOVA maximum. Okay, we can't go further. But if you see the standard peer review journal or high indexing journal or impact factor, and if you see across the different research article, they are means ये figure देखेंगे तो हम impress हो जाए, हो इसने ये factor analysis किया, ये ने ये किया, वो data तो देखो सब जगह सेम ही रहने वाला है. कोलेस्ट्रॉल, एज, सेक्स, जो भी वेरिएबल्स डिफाइन है, जितने भी है तुम्हें, उसमें कुछ चेंज होने वाला नहीं. सब जगह यूनिट भी सेम रहेगा. वो अमेरिका वाले यूज करेंगे या हम यूज करेंगे. ओनली द थिंग क्या डिफरेंट है कि हम लोग वो सोचते नहीं है कि ये चीजें अप्लाई हो सकती है हमारे में, या हम लिमिटेड कर देते हैं अपने आप को कि भाई इतने सारे डेटा तो हम क्या करेंगे. सो मैंने वो बोला ना, वो कोट था ना कि there are lot of information. What is lacking? We have not knowledge. If we gain the knowledge and if we know that in type of a data I can just you start the learning and apply. थोड़ी गलती होगी मगर उससे सीखेंगे.
All right, ma'am. Thank you so much for such an informative session. I just want to inform the participants that we'll be sending you the certificates till today afternoon. And once again, thank you so much, everyone, for joining. Now we are ending the session here. Thank you.
Okay, thank you so much. Thank you.